This lesson is on factors affecting population growth. In this lesson, we will consider the causes of population growth. What is population? It is the total number of people living in a country. The population is usually determined periodically by counting the people in the country through an exercise known as population census. Population growth. It is the rate of change in the population. It is usually a percentage rise or fall in the population. The formula for calculating the population growth is new population minus old population divided by old population multiplied by 100. A positive figure means the population has increased, while a negative number means that the population has decreased. We will examine the consequences of population change in detail in another lesson. Let us solve an example on population growth. The population of country X was 10 million in 2001. Calculate the population growth if the population rose to 11 million in 2002. Using the formula, the variables are as follows: new population is 11 million. Old population is 10 million. Therefore, population growth is 11 million minus 10 million divided by 10 million times 100. The answer is 10%. This means the population rose by 10% because the answer is positive. The chart shows the world population and those of the 6 most populated countries between 1950 and 2023. In 1950, world population was 2.49 billion, and by 2023 it has risen to 8.09 billion. India is now the most populated country in the world, having overtaken China. India's population increased from 346.28 million in 1950 to 1.44 billion in 2023. What are the causes of population growth? There are 4 factors responsible for population growth. They are birth rate, death rate, net migration, and fertility rate. Birth rate, death rate, and net migration are the 3 major ones. The 4th factor, fertility rate, is related to birth rate. Birth rate. Birth rate is the measure of total number of live births per 1,000 of the population in an area in a given period, usually a year. The formula for birth rate is total number of births divided by population times 1,000. Birth rate is also referred to as the natality rate. Developing countries tend to have higher birth rates than developed countries. High birth rate can increase the population. Why is the birth rate in developing or low-income countries higher than in developed or high-income countries? The factors affecting birth rate include living standards, use of contraception, attitude and religion, female employment, and late marriage. More children are being born in less developed or low-income countries due to the parents' low living standards and the belief that children will add to the family's income when they start working. In addition, many people tend to be ignorant or have less access to contraception. Religion also allows some people to be polygamous, thereby having a large family size. A high birth rate is responsible for high population growth in these countries. Developed or high-income countries, on the other hand, have a lower birth rate due to education and access to contraception. The high costs of raising children. Women choosing to pursue careers and therefore opting to have fewer children at a later stage in their lives. We will calculate the birth rate from the following table, using the formula for birth rate. Total number of births is 9,500. Total population is 155,000 plus 145,000, which is 300,000. The birth rate is 9,500 divided by 300,000 times 1,000. The answer is 32 per thousand. The second major factor affecting population growth is death rate. Death rate, also known as mortality rate, is the number of deaths per 1,000 of the population in a given period, usually a year. It is measured by dividing the total number of deaths by the population and multiplying by 1,000. High death rate reduces the population. Developing countries have higher death rates than developed countries. This means that, on average, people live longer in developed countries than in less developed countries. In other words, developing countries have lower life expectancy. Life expectancy is the average number of years for which a person is expected to live. There are other measures of death rate, namely infant mortality rate, maternal mortality rate, and general mortality rate. The first one, infant mortality rate, is the ratio of number of children under 1 year dying, compared to the total number of live births in a year. The maternal mortality rate is the ratio of number of mothers who die from childbearing to total number of live births per year. General mortality rate is the number of children born to an average woman in her lifetime. It can be measured by the number of live births per 1,000 women between the ages of 15 and 44 years. The factors responsible for low death rate include better living standards, access to good health care, absence of natural disaster, and absence of war. In some developing countries, poor living conditions such as hunger, poor housing, and poor healthcare system are responsible for high death rate. Calculate the death rate if a country, with a population of 50 million, recorded total deaths of 550,000 in a particular year. Total number of deaths is 550,000. Total population is 50 million. The death rate is 550,000 divided by 50 million times 1,000. The answer is 11 per thousand. Natural rate of population change. This is the difference between the birth rate and the death rate. If the birth rate is greater than the death rate, the population increases, because the number of children born is more than the number of people dying. If the birth rate is less than the death rate, the population decreases, because the number of children born is less than the number of people dying in the population. The third factor affecting population growth is net migration. It is the difference between immigration and emigration. Immigration is the inward movement of people into a country in a period. Emigration is the outward movement of people from a country in a period. If the number of immigrants is greater than the number of emigrants, net migration is positive. This is known as net inward migration. It increases the population. Net inward migration increases the labor force, because the number of people coming into a country exceeds the number leaving it. More workers are available to work in the country, which increases the total output of the country, also known as the gross domestic product, GDP. However, the rise in the population would make the social amenities inadequate. People will outnumber the available healthcare, schools, roads, housing, etc. Net outward migration. It means the number of immigrants is less than the number of emigrants. Net migration is negative, which implies that the population decreases as more people are leaving than coming in. What are the effects of net outward migration? It reduces the working population. This will reduce the total output, or GDP, of the economy. However, there will not be pressure on the amenities such as hospitals, housing and schools. The fourth factor affecting population growth is fertility rate. This factor is related to birth rate. It is the average number of children born by each woman. It is affected by the use of contraception, attitude to family size, female employment, and the number of women of childbearing age. These factors are the same as those affecting birth rate. A fertility rate of 2 children per woman may be considered to be the minimum replacement fertility rate for a stable population, that is, the number of children that the average woman must have to replace the existing population.